When the journalist Angela Epstein woke up the morning after a lively birthday celebration, she noticed a strange, foggy curtain effect over her eye. Assuming it was just the result of dancing, a few drinks, and a late night, she didn't think much of it. What she didn't realise was that this wasn't just a harmless haze, it was a warning sign that her retina, the thin, light-sensitive layer behind the pupil, which is vital for vision, had begun to detach. She says it was like she was wearing a pair of glasses with a smudge of dirt covering the top half of her vision in just one eye. Well, less than 24 hours later, she was having sight-saving surgery. Retinal detachment is rare in people under 40, with the condition most commonly affecting those in their 50s and 60s. Around 7,000 cases are reported in the UK each year. Catching it quickly can mean the difference between saving your sight and losing it for good. So I wonder if you've had this. Were you initially dismissive? Maybe you did leave the symptoms too long. Do get in touch. vine@bbc.co.uk is the email. Please include your phone number. You can text us 88291. You can WhatsApp us on the long number 08000 288 291. So in a moment we'll talk to Angela's surgeon Niall Patton, who is at Manchester Royal Eye Hospital. But Angela Epstein, first of all, hello.
Hi, good afternoon, Jeremy.
Well, we've never talked about your sight before, and I'm so glad you still have it.
Thank God for that. And you're absolutely right. The thing is that because a retinal detachment doesn't hurt, we tend as a species to react to pain. I want to make this go away, toothache. But this was just, like you say, a smudge. And it was only a conspiracy of circumstances that I had the good fortune to get it seen quickly, which is why I'm evangelical about people knowing. My son, who is a doctor, but not in this field, I mentioned it casually to him. And he said, I don't like the sound of that, and sort of asked me a few questions. I have a very good friend, Jeff Courts, who is an ophthalmic surgeon, and my son said, call him, and his wife's an optometrist, Anna, and I rang them and they said they knew almost immediately from what I said, check me out, knew exactly what I should do and where I should go, and within 24 hours I was in the supremely capable care of Mr. Patton, who I know you're going to speak to, who, thank God, managed to save my vision. But not everybody would either have, such strategically well-placed loved ones, or would even think, let's do something about this, because it's not really hurting, it's just an annoyance.
Well, it's amazing how lucky you are to A, have doctors in your family, and B, to then know somebody who does eyes. But you're right, it sounds as if what you had is something you thought, well, okay, I'll get through a couple of days with it, and then I'll see a GP if I must.
Absolutely, and I think Mr. Patton may correct me on this one, but I think the idea is to get that emergency care quickly, because you could go to a GP who might know what it is, but would they have the equipment to examine the back of the eye? I mean, I would go to an optician straight away. But the thing is, when you get to a certain age, I mean, I'm over 50, and, I think I fall into that demographic. I've got a few what they call floaters knocking around my eyes, those little bits of they look like little balls that bounce about every so often. And yes, you can wake up with blurry vision. I'd been to the most incredible party, had the time of my life, and just thought the next morning, a one cocktail to, and the cocktails were flowing.
Do you want to say whose party it was?
I couldn't possibly comment.
Okay, it was my 60th. We could say that. That's fine.
Okay, it was brilliant, but it was just sort of not something I do that often.
No, well, it's funny. I've got a perspective on this, because we were hanging out a bit. There were quite a few people there where there was some music, and I had some photos of people listening to the music, and there's quite a lot of pictures of you in the photos. And you're not struggling at that point. There's no question. But also you're not going crazy either. I thought back to myself, oh my goodness, did something happen at that party? But it didn't, did it?
No, I mean, I don't know if I can say who the special guest star was.
Oh, you can. Let's have the whole thing out here. Yeah, come on.
Okay, so Jeremy, who is a very dear friend of mine, I was very delighted to be part of the celebration with his gorgeous family. And Tony Hadley of Spandau Ballet fame suddenly popped up to do a set. Well, those of us of a certain age sped like lunatics to the front of the dance floor and formed an impromptu Jeremy Vine female voice choir, joining in to the chorus of True and all the other great standards. And I've looked at the videos and things, and I'm not doing any headbanging or anything like that.
No.
It was entirely benign, other than it was just a lovely evening of socializing. But I think obviously it hadn't just happened that second. I don't know, the expert will tell you. It was just this idea of the next morning waking up to something that wasn't there before, and thinking, what is that?
Well, let's bring Niall Patton in, consultant ophthalmologist at Manchester Royal Eye Hospital. Is it possible, and welcome Niall, is it possible that Angela's retina could detach without any trauma at all?
Absolutely. And in fact, the majority of patients that we see with a retinal detachment, they won't have any history of trauma. I think there's a common perception in the general population that when somebody gets a retinal detachment, it's because they got a knock to the eye, they fell over, or as Angela pointed out, maybe, head banging or something like this. And there are some famous retinal detachments in the past. For example, Frank Bruno suffered a retinal detachment, and obviously that amplifies this history of trauma. But the majority occur spontaneously. They just happen because the patient has certain risk factors, usually, the most common being short-sighted. And as a consequence of that, their retina is a little thinner than normal. And a normal event in everyone is that the gel at the back of the eye, the vitreous gel, starts to pull away from the retina. And as it does so, in most people, it's uneventful. But about 10 to 20% of people, when the gel pulls away, it tears the retina. And as soon as you get that tear in the retina, the two layers can separate from each other. And then what Angela described as a smudge or a curtain is a classic symptom. So they notice that it's like wallpaper detaching from a wall. That area represents a shadow in their vision. And as soon as it forms, it never goes away. And if anything, it will just get bigger and gradually move towards the center. And the tear itself creates lots of symptoms of floaters. So Angela talked about she had long-standing floaters that are normal. And the key thing is if you ever get dramatic new symptoms of floaters, so nothing subtle, it's usually quite dramatic. Sometimes use the analogy of like a snowstorm of debris floating inside the eye. So that, in conjunction with a shadow, would be definite red flags. And a lot of patients also describe a flickering, so like a flashing light sensation. Quite often they only notice it at nighttime when it's dark illumination. And those triad of symptoms or parts of them would, in any individual, particularly somebody who's short-sighted, make you think, okay, well, I need to go and see somebody urgently. And like Angela said, she has fantastic family members who's a doctor, and she's got a good friend in Mr. Quartz, who's a corneal surgeon. But for most people, the quickest, easiest way is to go and access their emergency care at their optometrist. So we have fantastic optometrists in the UK, up and down the country, who have got incredible diagnostic tools, great skills, and they're able to very quickly see you and assess you and determine, is this something of nothing, or is this a possible retinal tear or retinal detachment? And if it is, be able to lead you to the correct treatment.
I was certain you were heading for A&E at that point, and then you swerved and you went on to the optician or the optometrist. But they've got the tools there, have they?
They have the tools. So if you go to a general A&E hospital, so I work at Manchester Royal Eye Hospital, we're very lucky we have an emergency eye centre where people can walk in. But in most centres, it's a general A&E. So they won't have the kit and the tools being able to allow you to diagnose properly retinal tears and detachments. Whereas opticians up and down the country, they have all fantastic diagnostic tools. They're a much more appropriate resource. And if they, for any reason, listen to your history and say, well, they can't see you within a certain time scale, they would then advise you to go to the local hospitalised service.
I sort of want to ask Angela about the treatment, but I know that that's really Niall's field because you wouldn't have seen much of it. But do you tell me, Angela, from your point of view, what did they do?
Well, in short, basically, I was sedated and a local anaesthetic was applied. I was offered a general anaesthetic, but decided not to because that can have other sort of situations. And then I was out of it. I mean, Mr. Patton will tell you the retina was reattached. But I also had this gas bubble injected into my eye. And I think that was to support the retina as it was back in place. So again, he'll explain the medicine. But ultimately what happens is it's a peculiar irony. You go in for this surgery you still have vision, albeit a bit cloudy at the side. You come out not being able to see and you think, blimey, what's going on here? Because this gas bubble has to slowly dissipate like a spirit level dropping as the gas slowly moves away. And so for a week and a bit, I couldn't see anything. At no time was I in pain. I mean, I'm very lucky here in Manchester. I have, one of the best surgeons in the country attended to me, could see me very quickly, and I was entirely in his hands. And I would say to anybody, you get the good grace of a fantastic surgeon. You just have to submit yourself and understand that when they say afterwards, okay, you're not going to be able to see afterwards for a while. but this is why, and they explain it, because it is really freaky to suddenly think, I don't have vision in my eye.
And that involves, as Angela said, Niall, you're putting some sort of gas bubble to hold the retina back in place until it disperses, when hopefully the retina will stay there.
That's exactly right. So the gel within the eye has pulled on the retina and torn it. So the first thing that we do, we use tiny incisions in the eye, so small they don't normally need stitching, and we remove that vitreous gel, and then we flatten it with an air bubble. So the retina at the end of the operation is nice and flat because of the force of the gas. Then we literally do spot welding. So wherever the tear is, we put laser around it.
Wow.
So that seals the tear. And then when the gas dissolves, and our gases usually last 2 to 4 weeks, then as that gas dissolves, the laser around the tear has sealed it so that now there's no source for the fluid to separate the retina again. And it's a remarkable operation, and it's been around for a long time and usually very, very successful. But the crucial thing is to get patients early. There's nothing more heartbreaking than a patient who had classic symptoms for days or even weeks and didn't act upon them, and that's a crucial message.
And
really.
so, yeah, because had worst case scenario, Angela doesn't do anything for a week, is it possible then the retina falls off completely and you can't rescue it?
So we would definitely still be able to operate, and we'd be able to restore some vision, but Angela has an excellent chance of getting completely normal vision back. Whereas if she'd left it for a week, we would never be able to achieve that. We would get some peripheral vision, but our detailed central vision would be very reduced if somebody had left it for a week.
Oh,
And
Angela, I'm so glad you did really well, Angela. You're so lucky, aren't you?
Thank God I was very lucky. Like you say, I knew people. I also sort of just happened to be chatting to my son because I was in London. Thanks to your party, I don't live in London and my son lives there. It's almost like fate was on side. But I also have to say, we have these highly incredible skilled professionals, but ultimately the responsibility starts with the patient. I knew nothing about this, and this is why I'm being absolutely evangelical about it. But I'm just imploring people, if you've got a bit of a change, I would have been one of those people that would have ignored it had I not had somebody else to mention it to. So please, please don't.
Thank you very much. Angela Epstein, happily back to full eye health, and Niall Patton, who helped to get there, leading consultant ophthalmologist at Manchester Royal Eye Hospital. So tell us if you've had similar, where you have that kind of, what is it, an occlusion, just a bit of a smear or a smudge on your sight. What did you do?